Assalamu alaikum, learned panelist and audience. I'm Dr. Somayra Nasreen, working as assistant professor in the Department of Pediatric Cardiology. First of all, I'd like to show my heartfelt gratitude to IPDI Foundation and Professor Wadu sir and Monsi sir to give me the chance to talk in this very learned festive. Today my topic is identification of individual pulmonary vein on echocardiography. If we review the embryology development of the pulmonary vein, we are able to see through a complex process of development, pulmonary veins develop from early stage of development to term. So at any stage, any abnormality reveals remarkable diversity of the pulmonary venous anomalies, which include abnormal numbers, stenosis of one or all pulmonary veins, partial anomalous pulmonary venous connections, total anomalous pulmonary venous connections. Where in partial anomalous pulmonary venous connections, one or more than one, but not all the pulmonary veins drain anomalously into the systemic vein, and in total anomalous pulmonary venous connections, all the pulmonary veins, instead of draining into the left atrium, drain anomalously into the systemic venous circulation. So in the real world of echocardiography, no echo is complete until all the pulmonary veins are identified in the echocardiography report, as it is critically important for the structural intervention as well as congenital heart disease surgery. This picture depicts a apical four-chamber view. In this view, we are able to see a pulmonary vein is entering into the LA near its roof and close to the interatrial septum, and the jet of the color is parallel to the interatrial septum. This 2D echo, we are able to see a pulmonary vein is entering into the LA near its roof, and color flow interrogation reveals that the jet of the color is close to the interatrial septum and parallel to the interatrial septum. This is another picture depicts midway between the 4 and 5 chamber view. When the aortic valve is open, at that point we are also able to see another pulmonary vein drain into the LA located in right and posterior middle spect of LA and the jet towards the lateral mitral annulus. In this 2D still frame, we are able to see a pulmonary vein is drained obliquely into the LA in the midway between the apical 4 and 5 chamber view when aortic valve is visible. And the color flow interrogation, we can see that obliquely a jet is entering into the LA and the jet towards the lateral mitral annulus. So from the apical 4 chamber view and the near apical and 5 chamber view, we are able to identify the right lower and upper pulmonary vein very easily. We can also identify the pulmonary right upper and lower pulmonary veins from the subcostal view, especially in the neonates and young infant. In the subcostal sagittal view, when the SVC flow is seen, at the same time, SVC and between the right anterior pulmonary vein, we are able to see a vein is entering into the left atrium obliquely and the color is red. The parasternal short axis view is the best view for identification of the left upper pulmonary vein. In the parasternal short axis view at aortic valve level, when the left atrial appendage is identified, we are able to see another vessel is identified along its long axis, and the color flow interrogation reveals the blue color. This is the left upper pulmonary vein. Perpendicular to the left upper pulmonary vein, here the red color is the right lower pulmonary vein, and it's identified between the left upper pulmonary vein and anterior to the aorta. And aorta is identified in the pulsatile vascular structure. The suprasternal cleft view, this is the best view for identification of the all 4 pulmonary veins. Here the body of the LA forms the body of the cleft, and the all 4 pulmonary veins form the legs of the cleft. So the upper 2 pulmonary veins are identified as blue color and the lower 2 pulmonary veins are identified as red color. This is a very interesting study where they are doing the angiography and the contrast echocardiography of the individual pulmonary vein. They took a patient of the ASD, they put the catheter in the right upper, right lower, left upper, left lower. They do the contrast angiography and identify the pulmonary veins on the right upper lower and left upper lower in the apical 4-chamber, 5-chamber short axis and the suprasternal view. The pulmonary venous flow pattern is a biphasic forward flow, the S and D, and the small aortic atrial reversal. So these are some clips. This elderly patient was sent for the echo as ASD and severe pulmonary hypertension. During echocardiography, we didn't find any pulmonary veins entering into the LA. Rather, we are seeing that the pulmonary veins forms a venous complex behind the LA, and in the suprasternal view, we are able to see the vertical vein. This is supracardiac TPVC. This 5 months old was advised for the echo, as outside it was detected as primum ASD, but this is not a primum ASD, this is the dilated coronary sinus, and we are able to see all the 4 pulmonary veins drain into the coronary sinus. This is the cardiac TPVC. And this is another 5 months old, also presented as severe pulmonary hypertension. We are able to see ASD shunting right to left. The right pulmonary veins drain into the coronary sinus, where the left pulmonary veins drains into the left innominate vein. So this is a mixed type of TAPVC. So identification of pulmonary vein on echocardiography is not a luxury nor a wastage of time. With proper evaluation, we can identify all the pulmonary veins and therefore any abnormality if present. Thank you all for your kind presence.